renin-angiotensin system blockers. They block this hormone system that regulates blood pressure and fluid within the body. Diuretics, so water pills, and they help get rid of sodium and water via the urine. Called calcium channel blockers. They relax the blood vessels. Patients with certain cardiovascular disease, recent heart attacks, etc., they may be prescribed a beta blocker. Blood pressure tends to decrease at night. It drops about 10 to 15%. Then starting at 4 a.m., there's a sharp upward rise, and blood pressure peaks in most people between 6 a.m. and noon. That's when the majority of strokes and heart attacks happen, between 6 a.m. and noon. I take my blood pressure medicine, and then I'm going to check 2 or 3 hours after taking. A false sense of security. The medication is having its peak effect 2 to 3 hours after. If someone's taking a diuretic, a water pill, they shouldn't be taking that at 7 o'clock, 8 o'clock at night, because it's going to have its peak effect when you're going to bed at 10 or 11 o'clock. Similarly, the class of medicines, calcium channel blockers, if someone has significant acid reflux or heartburn, if they're taking that at night, it can sometimes relax the muscles in the esophagus and the stomach and the connection between those, and so it can worsen acid reflux. So if that's the case, we recommend they take that medicine in the morning as well. By losing weight, exercising, and a low sodium diet in combination, we can drop our systolic blood pressure by at least 15 millimeters of mercury, maybe even more. That they're maybe 70, 75, they have stiff blood vessels, and that's an effect of aging and somewhat genetics as well. Those patients, they may not be overweight, and they may be active, and they may be watching their sodium, but their blood pressure is still high. Those patients, I tell them no. They cannot come off medicines, but we try and keep them at the same number of medicines, just try and optimize the dosing for them, get them on the most potent medicines to control their blood pressure. They're more device-based therapy, where we'll eliminate the need for medications.